What is schizoaffective disorder? At first glance, it appears that the clinician is hedging their bets and isn't sure whether a patient is suffering from schizophrenia or a mood disorder. However, schizoaffective disorder occurs commonly enough to have its own separate diagnostic category. In ICD-10, it comes under the heading schizophrenia, schizotypal and delusional disorders. I'm Dr Beth Colby, a psychiatrist in London. Schizoaffective disorder is an episodic disorder where schizophrenic and affective or mood disorder symptoms occur simultaneously or within a few days of each other in the same episode of illness. As a consequence of this, the episode of illness does not meet the criteria for either schizophrenia or a mood disorder such as depression or a manic episode. Some patients have recurrent schizoaffective episodes, which may be of the manic type, depressive type, or a mixture of the two. However, if a patient has recurrent schizoaffective episodes, but also sometimes has a manic or a depressed episode, then the diagnosis of bipolar affective disorder is the most appropriate one. There are three types of schizoaffective disorder: schizoaffective manic, schizoaffective depressed, and schizoaffective mixed. Let's talk about schizoaffective disorder manic type. This disorder is where schizophrenic and manic symptoms are prominent at the same time or within a few days of each other in an episode of illness. A person may be elated, irritable, overexcited, with increased self-esteem, grandiose ideas. They may be aggressive and have persecutory ideas. They will also have some other manic symptoms such as increased energy, overactivity, impaired concentration, and loss of normal social inhibition, as well as having perhaps delusions of grandeur, reference, or persecution. In order to meet the criteria for this diagnosis, they must have some other more schizophrenic symptoms, such as thought broadcast, thought interference. They may believe alien forces are trying to control them, or they may experience auditory hallucinations or bizarre delusions. Schizoaffective disorder of the manic type usually has an acute onset and may last several weeks, but after this, full recovery occurs. For a diagnosis of schizoaffective disorder manic type, there must be a prominent elevation of mood or a less obvious elevation of mood with increased irritability or excitement. And with the same episode, at least one and preferably two typically schizophrenic symptoms must be present. In schizoaffective disorder depressed type, a person will experience symptoms of schizophrenia and those of depression within the same episode of illness or within a few days of each other. A person will have low mood with some other symptoms of depression such as lack of energy, loss of interest in everyday activities, sense of guilt, hopelessness, sleep or appetite disturbance, suicidal ideas, loss of concentration. The schizophrenic symptoms that they may experience could be those of experiencing that their thoughts are being broadcast, that they're being spied on, plotted against, or that alien forces are trying to control them. They may hear voices talking of killing them or discussing this between themselves. Schizoaffective episodes that are of the depressed type tend to be less florid than those of the manic type. However, they last longer. The majority of patients recover fully after each episode. To meet the criteria for schizoaffective disorder depressive type, a person must suffer from depression and have at least one or two depressive symptoms, as well as one or two typically schizophrenic symptoms. Schizoaffective disorder mixed type is used when somebody has symptoms of schizophrenia and those of a mixed mood disorder within the same episode of illness or within a few days of each other in the same episode of illness. Thank you for listening. Bye for now.